I'm Joe Tyler. Are you stressed out, wigged out, freaked out, feeling anxious, angry, or depressed? Want to know how people with real mental health problems are going to cope? Keep it right here on this YouTube channel. Get the latest word from experts in the field like me, Joseph Tyler, State of Nevada NAMI President for Advocacy, a speaker for the cause for mental health with the legislature, as well as the State of Nevada NAMI President. Here on Erasing the Stigma, we find hope for people whose lives have become unmanageable. So stay with us for the next few minutes as we erase the stigma for people with brain disorders. Today we have Mike Willden, the director of the biggest, I think it's probably the biggest program in the state budget, probably. I don't know, Mike, probably, right?
It is the largest department.
Yeah. And I wanted to jump right in here and say, because we're having a Medicaid expansion, which we'll get to the figures about, but how many people will we be treating that are not that will come upon Medicaid that were indigent? So we'll get we'll get payment for them now. Is that?
Thanks, Joe. Appreciate you having me on. So the question, how will what we call the Affordable Care Act expansion impact Nevadans, and particularly those with mental illness? There's two ways that the expansion will impact Nevadans. First is what we call the Medicaid expansion. Right now we have about 335,000 Nevadans on Medicaid, and our projections would indicate that we're going to grow to somewhere between 475,000 and 500,000 Nevadans on Medicaid. And that's largely that we'll be reaching in and providing new Medicaid access to a group of uninsured Nevadans at what we call the childless adults. Nevada has never covered childless adults under its Medicaid program, and that expansion will start in January. The other group that where it may be beneficial is that anybody with income, so the Medicaid expansion covers people below 138% of poverty, and the other way that people can get health care in the future is to access what we call the Nevada Health Link, also known as the Silver State Health Insurance Exchange. And for people with 138% of poverty income above that level, up to 400% of poverty, they can access insurance through the exchange or the Health Link, and they can get a what's called a premium credit through the federal government to help make their insurance more affordable. They expect to enroll over 100,000, somewhere between 100,000 and 120,000 in the first year. So you can see, Joe, the expansion is huge.
From 330 to 500,000, 470,000, you're guessing, something like that?
Yes, for Medicaid, and then another 100,000 plus on the exchange.
And the good thing about that is that at least for the first, when they first phase in, right, if I'm right, it will be the federal government will pick up 100% for it, right?
That's correct. Open enrollment for the exchange or the Nevada Health Link starts in October. There's a 6-month open enrollment period. The Medicaid, the new Medicaid eligibility, the expansion population starts January 1st. Mm-hmm. And so what we call the new eligibles, when Governor Sandoval made the decision to expand Medicaid to the new eligibles, for the first 3 years of coverage, for the new eligibles, 100% of their medical costs are paid for by the federal government, and then starting in years 4, 5, 6, 7, it ramps down to where the state has to eventually pick up a 10% contribution rate of the cost of medical care.
Yeah, that's great.
Yeah, it is big money. In fact, I was looking at budgets earlier this morning, and that our budgets have grown in the department from about $6.2 billion to $7.4 billion. So we're increasing $1.2 billion, and most of that comes from the healthcare expansion, the Medicaid expansion. And most of that expansion, that $1.2 billion, is federal money, new federal money coming in to cover people that we have not yet covered.
And I've heard, Mike, that when there's an infusion of Medicaid dollars, that they go real fast. They call, I don't know what they call that, where they go from the Medicaid dollars, people spend them, and then they spend them, and then they really resonate in the economy to build the economy too.
Yeah, so there's a economic term, it's called the velocity of the dollar, or the impact of the dollar in our community. So that new healthcare spending in Nevada, we've worked with the state demographer and UNR's schools of economics and business, and we worked with the professors up there, and we believe that the impact on Nevada's economy could impact it as much as about $6.5 billion in the economy. So in economics, there's three terms that we use: direct impact, indirect impact, and implied impact. And so direct impact is that doctor who directly treats you, but then that doctor is going to go hire some support staff. That's indirect impact. And then all of those people will go shopping, go to the movies, do whatever they do. And so that has an impact on Nevada's economy. And there's estimates that it could mean as much as 3,000 to 4,000 new jobs in Nevada also. So it's an exciting time to see how that rolls out.
That dovetails right, Mike, into the question that I wanted to ask, because we're gonna add not only, well, I don't know about doctors, but there are people with I understand, Mike DeClario talked about master's degrees that will be supervising both public health assistants and behavioral health assistants. And what kind of qualifications do they have to have for that?
Joe, I don't know that detail. I probably have to get you that detail, the qualifications, but I could answer this. I mean, as we've just talked about, hundreds of thousands of new eligibles covered, and many of those haven't had access to primary health care. I mean, they basically show up when they have an emergent need, whether that's in a hospital ER or presenting themselves to one of our service delivery programs. And so one of the things we're working on is really having insurance coverage is one thing, but having the access to a healthcare provider
because with this
is
many new
else.
people coming on, we're going to have to add some new providers, it would seem.
Yeah, in fact, I'll be traveling to Vegas tomorrow, and Friday we're having a conference with university staff. We're bringing in some national consultants. We got a grant through the National Governors Association to help explore that access to healthcare and what we could do. I mean, you've either got what we call grow new healthcare professionals, which, more nurses, more applied healthcare credentialed people, more doctors. You got to recruit them from other states, but that's going to be a challenge because everybody's going to be expanding their healthcare coverage. Or we have to look at the alternative delivery methods, what we call physician extenders, or like you said, have the licensed therapists or master degree people provide services either under the license of another professional, or make sure that we define what scope of service they can cover versus another professional can cover.
Which once again dovetails into what I was talking about, because the consumer service assistants could not normally, I'm at the CSA at the hospital, could not normally bill for Medicaid. But under this, if the state picks us up, so we're not being paid by the federal government on a block grant, but by being paid by the general fund for the legislature, that CSAs can bill, and so we're adding more people, more techs, and more people that can bill for Medicaid.
I think that's an important point, Joe. I mean, I think a proud moment, I guess, for the department, but maybe frustrating for other providers, is that most of our mental health services and our drug and alcohol services have been supported by general fund dollars over the years. Mm-hmm. And now the whole paradigm has to shift. You have to look at healthcare through a different lens. There will be less state general fund dollars providing the services, the direct services that we provide, and that our providers will need to position themselves, get licensed, accredited, certified, whatever term you need to inject there, and they need to learn to bill for Medicaid. That is going to be the wave of the future. Either you got to bill Medicaid for services provided for those low-income individuals, or you're going to have to bill someone's healthcare carrier, the new people that are going to be insured through the Nevada Health Link, the exchange. And so there's going to be a huge paradigm shift over the next year. And I know a lot of providers are anxious, maybe even frustrated, that they're going to have to tool up and be able to provide services that are billable, and then know how to bill for those services and get reimbursement from Nevada Medicaid or an insurance carrier.
And Mike, one thing that I was thinking about that we talked about throughout the shows we've done, you have your office has the ability to prior authorize or prior authorization for medications that sometimes would be quite expensive. And because I don't know whether I haven't been to a pharmacy and therapeutics committee meeting for a while, but I know that the fact that medications are expensive and how we decide which med can be used and which med needs to get a prior authorization for. So
yes.
How's that?
So Joe, how that works? Nevada Medicaid does have what we call a pharmacy and therapeutics committee. Then it's a group of doctors and pharmacists that review all the medicines that are out there to help people, whether they're psychotropic medication, antibiotics, you name it. We review the classes of drugs, and we put them into two groups: one, preferred drugs that don't require prior authorization, and then non-preferred drugs that do require prior authorization. So nothing will really significantly change under the Affordable Care Act on that. I mean, there still is a requirement for the P&T committees, the Pharmacy and Therapeutic Committee, to review drugs as to what's preferred and what's not preferred, and there still will be a prior authorization process. The volume will change because we have more eligibles on, but we have contracts in place that we believe we can timely prior authorize, drugs, and that people can get, the drugs that their physician, generally wants them to be on. Again, we have a preferred drug, but if a physician says Joe Tyler does better on drug B rather than drug A, then there's a way for the physicians to get that prior authorized. And we do that frequently.
Let's see, so anything else? Oh, I know, the tobacco settlement, this is kind of the thing that I'm proud of, and maybe you are too, I hope so, but the tobacco settlement dollars went from, when the governor first approved tobacco settlement dollars, I don't know what they go for, there was a number of different things that they go for, but we said that the people with mental illnesses smoke 55% of the tobacco used. And they only represent 6% of the population with serious mental illnesses. So I had people call the governor's office and say, give us more of the tobacco settlement dollars, because they were only given, Governor Sandoval was given $2 million to start with, and then it got all the way up to 16 million, I think. I believe that's what the total was. And what would that go? Do you know what that would go for?
Well, you're probably mixing a couple apples and oranges there. Maybe. Let's talk a little bit about tobacco settlement, and then I think you're asking a question about how are we funding some of the mental health services. So, Nevada Department of Health and Human Services is a recipient of about $23 million a year in tobacco settlement dollars. There's a national settlement, what we call a master service agreement, and the state gets a check every year from the tobacco manufacturers, and 40% of that money goes to support the scholarship program, the Millennium Scholarship Program.
That's what governor's down through the years.
Yes, 60% of the money then comes to my department, the HHS, and we use that to fund a whole host of services. We provide senior pharmacy services, we provide senior independent living services, assisted living, tobacco cessation programs, wellness programs that include suicide prevention, some of the issues that you're talking about, access to health care, mental illness issues, help funding our PAC team, our Southern Nevada program for assertive community treatment.
Direct mental health.
Right.
Program.
Home visitation program, a new program that we're dealing with people with mental illness, making sure there's safety in the home, that there's safety plans there. We set aside some contingency funds for some mental health. So that $23 million coming in helps fund some of the mental health programs. But that's not the only funding source. I would note that in the last month of the legislature, Governor Sandoval asked us to beef up, which is a great opportunity for us. Times have been tough for 4 years. And so in the tail end of the session, we had an opportunity through a one-time infusion of some of the tobacco money, and then just the fact that as you get through the session, you discover there's some additional general fund dollars available to allocate. So the governor allocated almost an additional $17 million in the last $16.5 million in the last month of the legislature, and we're funding, like I said, these home visiting programs, both north and south, to make sure there's safety in the home. And there's groups working on getting those dollars on the street. We're brought back on a second PAC team, the program for assertive community treatment down south. We're funding some additional beds for Lakes Crossing, our forensic facility.
That's right, there was a 10-bed
expansion.
Yeah.
We have what we call a jail or prisons reentry program that is funded to help people coming out of our correctional facilities and jails. We know many of them are in jail, not because of the crime they committed, but because also part of their mental illness. And so we want to stop that recidivism. And then we also have set aside some contingency funds to help us through. We're in Southern Nevada, we're having some difficulty with our emergency room wait times, and we're working on that. Dr. Green and Richard Whitley and others are working on trying to get those wait times down. So again, a bonus for our mental health system, about $17 million added to the budget by the legislature and the governor in the last closing weeks of the budget.
Yeah, that was great.
Partly out of tobacco and partly out of general fund.
That's great. So we're doing, times are looking better, I think.
Yeah.
Stuff's looking better.
Yeah, it's been a rough road, as you guys know. I mean, from the last 4 years of tight times and having to basically hold status quo to, I think we're coming out of those economic doldrums, and again, things are looking a little better, and we will continue to make progress on mental health and on a lot of other things, healthcare in general.
Thanks.
Thanks, Joe.
Thank you. Okay.
Nice to see you.
Yeah, good. This is good. There's so many things, man. It's great. That's great. Good stuff.